Joining us is Dr. Raul Rosden with St. Elizabeth's. Welcome.
Thank you.
Now, I understand you have a special treatment for patients with liver cancer.
Yes, we're offering a treatment called radioembolization, and this treatment involves directing high-dose radiation to liver tumors without delivering high-dose radiation to the healthy liver tissue. Okay. And it's very interesting because we can do it with a very minimally invasive catheter-directed treatment to the liver. So
now, why is that important for patients?
Well, it's important for patients because now they have a minimally invasive treatment. A lot of times liver treatments have been surgical or have been really high toxic drugs or high therapeutic drugs, and we want to now offer something that's not as invasive for this treatment.
So does this mean this would give a quicker recovery time?
Yes, there's quicker recovery time. It's actually an outpatient procedure.
Oh, wow.
And it's people come in and we work them up, of course, in the clinic, and then we see how they would do after the treatment, and generally it's a in and out procedure in a day.
That's wonderful. Mm-hmm. Now, why is it important to get all of that done in one day?
Well, it makes it easier for the patient to handle. They're going through so much with liver cancer to begin with, so it makes it easier for them to deal with this. It's an outpatient setting.
Yeah, definitely. Mm-hmm. Now, what are the symptoms for liver cancer? People should definitely get into that right away.
Sure, there's lots of symptoms for liver cancer, but most of the time you see it. People have swelling and a little bit of, they may have a little bit of abdominal pain. Mm-hmm. Sometimes there's lots of different symptoms, but people have fluid in their belly. But most of the time, their oncologist or their doctor would work them up with a CT scan, and then they'll find the tumor, and then we can figure out how to treat it afterwards.
That's wonderful. Now, if anybody is interested in this program, how can they do that?
They can contact St. Elizabeth's. We have St. Elizabeth's offers the Y90 or the radioembolization treatment there. They have a DynaCT machine, which really is a three-dimensional imaging which we can use to actually pinpoint those tumors in the liver and get the therapy right to it. And if they call St. Elizabeth's, they'll be able to get in touch with us.
That's wonderful. And it's you and another doctor, is that right?
Yes, my partner and I, Dr. Vanderwoody and Dr. Rasner, are the two guys in town only doing it right now.
Oh, that's wonderful, and good for you guys for
great.
doing
Thank
that
you.
for your patients.
Yeah, great, thanks.
Well, thank you so much for joining us today.
Absolutely.